Hi, and welcome to Ask the Horse Live. I'm your host, Haley Kerstetter, digital editor at thehorse.com. Like humans, horses can develop allergies to environmental elements such as dust components, mites, mold, medications, shampoo, and food. Some horses might show respiratory signs, while others can develop itchiness or hives. Understanding what causes your horse's allergies and working with your veterinarian to treat his clinical signs can improve his health and well-being. This event is sponsored by Kinetic Vet. To answer your questions, we're joined by two expert panelists, Dr. Jonathan Yardley of The Ohio State University and Dr. Susan White of the University of Georgia. Welcome to both of you.
Thank you for having us.
Dr. Yardley, can you tell us a bit about your background?
Yeah, sure. I am a graduate of Tufts University in 2006. I did some additional training in Ocala, Florida, did some racetrack work, did mixed animal practice for 6.5 years, and now I teach at The Ohio State in equine, where I take fourth-year veterinary students out into the field with me on a daily basis, seeing general farm calls in our area.
Awesome. And Dr. White, could you tell us a bit about your background?
Yes, I grew up with horses and competed in hunters, jumpers, eventing. I went to veterinary school in Davis, California. However, I've lived in Georgia for greater than 40 years, and the majority of my career has been spent on the faculty at the veterinary school at UGA. And because I live in the Southeast, I've had a lifetime of experience with allergic disease in horses, since our heat and humidity are sort of capital of those problems.
Before we begin answering questions, I want to remind everyone of our Ask the Horse Live format. We're starting with questions submitted during registration. If you're listening live and would like to submit a question, please do so via the chat window. We'll do our best to get to as many of your questions as possible. If you're listening to the podcast recording of this event and would like to join us live in the future, please visit thehorse.com/askthehorselive to register for notifications. And with that, we're going to jump in. So Dr. Yardley, you have the first question tonight, and it's from Jennifer in New Jersey, who wants to know what it means when veterinarians say a horse has allergies.
Yeah, that's a great question, Jennifer. I think for the most part, what we talk about with allergies is we're seeing some sort of external signs of the immune system recognizing a foreign antigen or protein that the body's not used to and forming an immune reaction to it. So some of the clinical signs that we normally see or we can see in our horses are some pruritus, some itchiness with the fly bite hypersensitivities. You can see some a runny nose. You can see runny eyes. So allergies is just kind of like a generalized name that we give it without any more specifics. I kind of think about it as like when we say your horse has colic, there are lots of different types of colic. So allergies is a kind of a blanket statement for lots of different immune responses.
Dr. White, Camille in North Carolina says her mare coughs and sneezes when she first starts trotting. Could this be a sign of allergies?
Yes, it could be a sign of allergies. Horses can have an immune response to inhaled allergens, be they dust and mold particles from a dusty ring or anything that might be in the environment. They I may use the coughing when they first start trotting, which is an increase in the volume of air going in and out of their lungs as they get a faster gait. They use that cough to help expand airways. If it's only a few times at the very initiation of trotting and the horse shows no other signs, it may simply be an irritation from particles that have lodged in the upper airways or in the trachea down to the base of the trachea. So you could observe your horse at other times, at rest, and study its breathing pattern. Notice if it has a slow rate of respiratory recovery, and get your veterinarian involved to see if it's more serious than just upper airway irritation.
Dr. Yardley, Jean in New Brunswick asks if there are any alternatives to soaking hay for a horse with allergies when the temperatures drop below freezing.
Yes. I'm assuming she's in New Brunswick, Canada, where it gets cold very quickly. But one of the best things they have on the market are the hay steamers. So a hay steamer is able to heat, some of them heat up to an entire bale of hay at a high temperature steam. And it actually does a couple things that are actually very helpful. So it actually have shown that this steam can decrease the bacterial and fungal load in the hay. So it's probably even more advantageous than just soaking hay alone. And they've shown that in the studies, like it doesn't leach out any additional vitamins or minerals. So I think a hay steamer would be one of the best ways to go. The companies can say how long the hay lasts for, so you do want to be careful with the hay steaming that you don't steam your hay and keep it around for long periods of time where then it's moist and maybe could grow some additional fungus on it. I think one of the things to think about with hay steaming is I have had some clients that try to make their own hay steamers out of like stuff you'd steam your clothes with. And I don't believe that that's high enough pressure or high enough steam quantity to actually kind of kill the bacteria and fungus in there, and you're just kind of wetting the hay. So I would not recommend against do-it-yourself ones, and I would go out and purchase one that has a company's behind it and has said this is past all our quality standards. But a hay steamer is definitely a way to go, especially for any horse with asthma. It's probably better than soaking. It's easier than soaking. There is a little expense associated with it, unfortunately, but it is a really great alternative to soaking, especially in the frozen conditions.
Dr. White, Patrick in North Carolina wants to know what the common treatment and prognosis is for adult horses with hives.
I would assume that if Patrick is speaking about his horse having hives, that this is a horse that has serious asthma and probably has increased labored breathing, especially on expiration, and coughs, and may or may not have nasal discharge. The most important thing you can do to decrease and try to prevent allergic responses to inhaled antigens in the case of hives is trying to limit the allergen as much as possible. Hay steamers are wetting the hay, keeping them out of dusty conditions, using bedding that has very little organisms or dust associated with it. Of the medications that are used for hives, the most common ones are corticosteroids. And the best way to give those corticosteroids is by inhalation. There's a number of devices on the market for aerosolized corticosteroids to be administered to the horse. And these limit the amount of steroids that you have to use because the bronchioles are very rich with steroid receptors, which decrease the immune response. Other medications are antihistamines, which are helpful in some horses, but not all, and bronchodilators. But all of the medications should definitely be given under the direction of a veterinarian. The prognosis depends on how severe and continuous the allergen challenge is to the horse's respiratory tract, and also how the horse responds to medication that is used. If the horse responds really well with minimal medication, then the prognosis is quite good. But horses in the past, before we knew as much as we do now about asthma, would die from hives because of low oxygen tension. And so that's why I say that it's really important to have your veterinarian involved in making a management plan for your horse.
Dr. Yardley, Rebecca in Arkansas says her mare loses hair every year from chronic hives. Is there anything she can do to prevent this?
Yeah, so I think one of the biggest things with the hives is learning what the allergens are that are causing the hives. So is it the bedding source? Is it something in the environment? Those are going to be the biggest things. And if you're in Arkansas, I'm assuming she could also be having a fly bite hypersensitivity. So culicoides or sweat itch is one of the other things they can call it. And you wonder if that's more of what's along the line. So if it is an insect type of hypersensitivity or allergy, then I would recommend fly sheets. So trying to decrease the amount of area for the flies to bite the horse. Fly boots I have found to be very helpful so they don't bite their legs as much. And then using a permethrin-based fly spray. We all know fly sprays aren't super efficacious, but you can at least try it. So that would be my question as to like why the mare is having these types of hypersensitivity reactions. So is it truly these kind of allergies, or is it caused by something else in the environment as to why she's losing hair? So it would be hard, it's hard to know without like seeing a picture of the mare.
Dr. White, Teresa in Manitoba wants to know if long-term use of antihistamines can have any negative effects on a horse's vital organs and other systems.
A really simple answer to that is no, they don't have an effect. First, generation antihistamines cross the blood-brain barrier, and they can cause drowsiness, calmness in an excitable horse, or in severe situations, mild neurologic signs. But that's been mostly bypassed today by the use of second generation antihistamines. If you go, to Dr. Google, there will be a long list of what antihistamines can do, and this is related to people, and yet even in humans, the bottom line is they have very little effect on vital organs. So if you have a horse that is responding well to a second generation antihistamine in the doses that are publicized and researched for horses, you can give them for an extremely long time and not expect any adverse side reactions. There's always the outrider, the once in a how many chances of anything that is a medication, an animal can get allergic to it. You can read that in your own prescriptions. They say, if you are allergic to this medicine, don't take it. But for the majority of horses, antihistamines are perfectly safe.
I just want to add a quick thing. I agree 100%, but for people that are showing their horses, we just had a client that got a cetirizine positive. So it is banned in a lot of competitions where USCFT or FEI testing is occurring. So please be aware of the withdrawals, and the withdrawal times posted can be different depending on the horse because they're given orally. So make sure you talk to your veterinarian if you are using these antihistamines and you are showing. The fine is quite hefty, so just be careful.
Yeah, that's a very good point. And that is even more important because the list of prohibited medications gets longer every year.
Every year I learn about new ones.
That's a great point. Dr. White, we have our first question from our live audience. It's from Sherry in Oklahoma, who has a horse with severe skin issues and allergies. She said they've done scrapings and biopsies as well as allergy responses. One came back with malassezia, yeast, and inflammation. She's been giving Zyrtec and bathing with ketoconazole shampoo and has also used antifungal creams. The horse also seems to be hypersensitive to flies. She's used all sorts of sprays, herbal and otherwise. Do you have any suggestions for her?
Okay, this horse has been on chronic antihistamines with no response, and the skin scraping showed superficial yeast infection, and she is using ketoconazole shampoo on the horse, and it's not solving her problems. Is that a summary of what she said?
Yes, you've got it.
Okay. The If it's insect related, insect bite hypersensitivity, then everything that can be done in the managing the environment and the horse needs to be done. Dr. Yardley spoke of this when he said fly sheets, leg guards, whatever. The use of topical fly sprays is a whole subject in itself. There are horses that developed hypersensitivities to pyrethrins and permethrins. There are horses that respond adversely to topicals that are to repel insects that have oils in them, because the oil will sort of seal the skin, and then if there's heat, whatever is beneath the oil and on the skin gets cooked, which makes the skin worse. And you may need to use a proscribed course of corticosteroids to break the itch scratch cycle. And if it's been tested for the presence of IgE antibodies to allergens, either by the serum test or by the intradermal test, if the horse has not yet had a course of allergen-specific immunotherapy, then that is definitely something to try. I think it is best to begin that medication not at the height of the insect season and the height of the skin signs and the pruritus or the itchiness, but build it through the winter and then have it reach peak before the insect season starts. All of these things will generally help diminish the skin's response to very hyperallergic horses, but you have to do, like she is doing, you have to do a number of things simultaneously to help the horse. Here's where you need a good relationship with a veterinarian that is interested in skin, that can carefully go through your management, your feeding program, your medications lists, and then stick with it, because sometimes it takes a while to find a regimen that's going to help the horse. They can be very frustrating. I have spent a career on these horses.
Dr. Yardley, Colleen in Michigan says her horse has severe allergies to bug bites, but antihistamines don't help him. What can she do to help keep him more comfortable?
Yeah, so I think going back to what we had talked about earlier with using the fly sheets and fly boots, trying to decrease those the area that the flies can bite the horse. The other thing would be environmental considerations. So like, where's your manure pile? How far away is it from the barn? How often is the barn being cleaned? Fresh water sources nearby. Those types of things, environmental. So if the antihistamines aren't helping, you can move up to corticosteroids, such as dexamethasone orally. I will put a caveat out there that dexamethasone, especially in an overweight horse, will make them more prone to insulin dysregulation, so insulin issues, which will lead to laminitis. So that is kind of one of the things we do always worry about with steroids usage in horses, even in in some of our research at Ohio State with dexamethasone, we have been able to turn normal horses into insulin dysregulated horses just with the administration of dexamethasone. So we do have to be very careful with this drug. So this is why we kind of always work towards environmental situations. You could try, there's limited data on adding omega-3 fatty acids to the diet. It looks like in the literature that more fish-based oils were better than some sunflower oils for the omega-3 ratios. There's something to do out there. I don't know if that would help the situation. The situation does seem pretty severe. The other thing would be allergy testing, like we talked about with the last horse, doing allergy testing, knowing what the horse is allergic to, and then you would give allergy, quote unquote, shots, or we've had some success. There's some manufacturers out there that now give the shot underneath the tongue, so they give it orally. Just like in humans, immunotherapy for allergy shots take time. Like they take a long time to because you're building up the horse's immune response to these antigens. So it does echoing what Dr. White said, is not something you're going to start in the middle of summer when it's really bad, but something maybe when the situations are better. So getting your horse allergy tested, preferably intradermal skin testing, which is usually done by dermatologists, I believe yield the best results. There are a lot of veterinarians that do use blood tests for allergens. I think I'm going to let Dr. White, she's more of an expert on this than me for the differences between the two, but I do know that the intradermal skin testing is the gold standard. If that's not available, I think the next best thing would be serum testing.
So you can tell from all of this, if you're not totally overwhelmed, is that it takes time, it takes investigation of the environment, fans in the stalls to keep insects from landing, etc., to come up with something that's going to work long term. And I think I'll just leave it at that. There are some articles available on the internet that are extremely well written about managing severe allergic dermatitis in horses, and that would be a great place to start. And who knows, one of our horse employees here, there's 3 of them on this webinar, can be in touch with you later and reference some of the things that have been written in the horse magazine.
Dr. White, we've had a few people from our live audience ask this question. It's what's the difference between first and second generation antihistamines, and what's the equivalent of Benadryl for horses?
Benadryl, there isn't an equivalent. It is Benadryl, has been used in horses. A first generation antihistamine, for example, is hydroxyzine, which is a common antihistamine used in horses. In my personal experience, before cetirizine was affordable in the amount you had to give a horse, it was quite good in controlling hives, particularly hives associated with IBH. And the first and second generation depends on how the drug is metabolized in the horse's body. And as I mentioned, the first generation ones like hydroxyzine crosses the blood-brain barrier and has some effects in the central nervous system, which can cause drowsiness in the horse. The second generation ones are chemically different in their structure. They still affect the immune response, but they can't get across the blood-brain barrier. So what you've done is bypass any side effects of the medication. And for example, Benadryl, it's given in people sometimes as a sleep aid just because it affects the central nervous system. And we're not supposed to talk about products on these webinars, but in the horse, the 2 most common antihistamines are either cetirizine, which is now affordable and useful in many, many horses, and hydroxyzine, which I used for many years before we had generic cetirizine.
Dr. Yardley, Carrie from our live audience has a horse that is showing improvement with allergy shots. She's wondering if she needs to retest the mare at some point and whether the horse needs to be maintained forever on the injections.
Yeah, so usually when we do the allergy shots, I'm glad to hear that is helping. I like to hear these stories because I think, like Dr. White has highlighted already, allergies take some time to treat, and you need to be patient with them. So I really love that she was able to do the allergy shots and see some differences. We usually do retest them once a year, once every other year, just to kind of see if things are changing in the environment. Anytime the horse moves locations, if we like, especially move states, there's different pollens, there's different allergens out there. We probably recommend retesting after being there. And then usually we do keep them on like what they consider a maintenance dose. So I don't know if she just started, but she'll start at a very high dose of allergens very often. And then they kind of tailor down to a more maintenance level of the allergen shots. So it is something that they kind of stay on for quite a long time. And that's why I've had my clients go to the sublingual. They've seen, or under the tongue, good results. That way they don't have to give the horses shots all the time.
Yeah, but the lingual ones are once or twice a day, and the shots are once a week, and then can sometimes go to once a month. So it depends on the management of the horse. And in younger horses, atopic, very young animals, 2 years old, 1.5, up to maybe 5 or 6, some of those horses, after several years of the allergen shots or sublinguals, may not need to continue. Older horses, in my experience, have to stay on I haven't had that many people that use the sublingual medication, but the ones on the allergy shots, they can get down to once a week, once every 2 weeks, but they stay on it for a very long period of time. And it's a tiny little amount that gets injected, and most horses don't even notice that you've given it to them.
Yeah, the smaller the needle you use.
Yeah. And the nice thing about allergy shots is they're not weight dependent, and they are not going to interfere with any drug testing that's done. They're FEI free.
Which is important these days.
Yeah, if you have a contingent of, well, I don't know what Dr. Yardley's practice is, but if you have a lot of competitors that are showing in FEI rated shows, it's really important.
I would agree.
Dr. White, Linda in Florida wants to know what ingredients are most effective in repelling biting insects.
This is one of those questions that we could talk a lot about. The most common ingredients found in products sold to repel flies are either pyrethrins or pyrethroids. Pyrethrins are a natural product that are derived from certain types of chrysanthemums, and pyrethroids as a class, of which permethrin is one, are synthetic man-made drugs, if you will. And in truth, they're insecticides, not repellents. So, they maybe warn the flies, but, if you spray them on a horse and that's covered with flies, you'll notice some just sort of dying off the horse. They come available in all sorts of concentrations to apply to the horse. High concentrations sometimes will elicit contact responses that make the horse itchy, make the horse's hair stand up, and they may scab over, such as the spot-on products that people use, like you would use spot-on a dog. And there's a fair population of horses out there that develop either contact dermatitis or allergens to them. And the flies are responsible for IBH, so you put more fly spray on them and they get worse. And it's kind of a continuing situation. The market is swamped with herbal essential oil repellents, some which may help and some which may not. The thing about many of those multiple holistic, if you will, medications, like tea tree oil is in a lot of things. Tream is the active ingredient, can cause pemphigus-like lesions in the horse, and it's really ugly. I have lots of photographs of that. So you have to be careful about the vehicle as well as what's in the product. Recently, the EPA, the Environmental Protection Agency, has labeled DEET, which is the repellent found in off and various products for humans, as safe to use on horses, with the quote caveat of as directed on the medication. And if you go to Dr. Google, you'll find testimonials for all of these products, whether it's DEET or whether it's a pyrethroid or whether it's an essential oil or citronella. There's a new kid on the block, picaridin, used in people and labeled as safe for dogs, but it's so expensive that I can't imagine somebody's using it on a whole horse. So my advice, and before I go on, insects can develop tolerance to permethrins and pyrethroids, which is why you find increasing dosages or concentrations in the products that may be recommended, for example, by Dr. Google. So they don't all work in all situations. And I reiterate what Dr. Yardley first brought up about the use of fly sheets, the use of fans, either in run-in sheds or in the stalls, and hopefully not the box fans at Walmart and Home Depot, but ones that are made for outdoor use, because those box fans are the leading cause of fires in barns. They're not made to be used in dirt. So my advice would be, if you're using a product, test it in a small area on your horse and observe whether it's having the desired effect. Active ingredients. If it's less than 2%, you don't have to be able to say the complicated chemical names. If you pick up a bottle and you read the active ingredients, if they add up to less than 2%, chances are it's not going to be very effective. And those commercial fly sprays have a very short duration of action. And so if you use them, you should use them when you expect the highest pressure of the type of insect you're trying to keep off the horse.
Dr. White, we have a question from Kim in our live audience who is asking how long it takes to start seeing results after starting allergy shots.
It can take usually about 6 months, sometimes up to a year. But if you begin your regimen of allergy shots once the insect population starts to decrease, I mean, I'm in Georgia, so you say, October, November, you start your series of injections, and you go November, December, January, March, April. So you're at 5 months at April when most of the insects start to appear. They won't get really bad till May. Then you may see some benefit that year, which is 6 months or so past when the initiation. I tell my clients, when they choose to do allergen determination, and I agree with Dr. Yardley, IDT is the gold standard, because you're testing the allergen where the problem actually exists, in the skin. I tell people they have to be able to be patient enough to give it a year before they determine that it is helpful or not helpful. But here again, we can all give examples. Horses that were hamburger that go to being where they've scratched themselves and steroids are not helping, and they go to getting one injection a week and they're fine in the summer. Those type of cases are what tell me to offer this as a possibility to owners. I never say you have to do it, because you can't guarantee that it will work in each individual horse, but in a great number, and even in the majority of horses, if you believe the few publications that are out there, and you believe the gurus in equine dermatology that say over a lifetime that the majority of horses are improved with allergy shots. And would I do it for my horse? In a minute.
I was going to throw back with one of the questions about hives earlier. I do treat a lot of barrel horses here in Ohio, and some of those horses with inflammatory airway disease have improved with the allergy shots also. So even though it's not on the skin, but we're looking at the lungs, kind of talking about allergies, we have seen a good response in those horses, and we've in the barrel horse population and in the racehorse population, we know that the inflammatory airway disease can more likely lead to these horses bleeding while exercising. So kind of the allergens, controlling the allergens that way is another good benefit of these allergy shots. And yes, it takes a lot of time.
And that's a really good point, because I wanted to be sure we brought up tonight that it is the way the individual horse's immune response answers questions by allergens that are presented on its skin or it inhales. And it has been shown that horses with skin allergies are more prone to equine asthma, and horses with equine asthma are more prone to skin allergies. Therefore, when you're devising a management regimen for these horses, they should all be treated like they have asthma. You know, do the best you can for environmental allergens to be eliminated. And this is one thing that the horses that would come to me in the hospital at the University of Georgia, they're usually desperate. They've usually worked with a veterinarian, often well. And so I would say if they're on like 10 supplements, I said, you have to first take away all the supplements. We have to give a washout period in this horse so that we know we're starting at base zero as we try and manage their reaction. So when you think about management, don't just think about skin or just about the lungs. Think about the whole horse.
And I'll add to the supplements, while they don't feed those supplements, they can save that money and buy allergy shots, which have some evidence at work. So just kind of a shout out there.
Dr. Yardley, Linda in our live audience who lives in Florida, where there's a very long insect season, wants to know whether you can add dexamethasone to fly spray. She's tried fly sheets, but her horse stops sweating when he's wearing them.
Stopping sweating is a bad thing, especially in Florida. Dexamethasone to fly spray, so topical dexamethasone, I don't know how well it would be absorbed on the skin, and I would be in how much it would control the response, because most of the response is probably happening underneath the skin from the saliva of the insects. So I'm not sure if the dexamethasone would be helpful. I would also be really worried about overdosing your horse, because we don't know how much gets delivered through the skin, like how much dexamethasone is getting through the skin. So I would probably advise against that. Especially if you're spraying the whole horse. I would hate to overdose your horse and cause a bout of laminitis.
I want to jump in here too. There are commercially available leave-on rinses for the horse that have hydrocortisone, which is much less potent than dexamethasone, and are very helpful in horses that you're doing all you can. You bathe the horse or just rinse them with cool water being anti-inflammatory and antipyretic in itself. And then the final rinses are these leave-on hydrocortisone rinses, and very little of that hydrocortisone actually goes systemically. Hydrocortisone is labeled for the use on irritated baby bottoms, and if they can put that steroids on a human baby, that it's probably not a systemic problem. And I agree totally with Dr. Yardley. If you have a horse that has atopy, they have skin barrier dysfunction, and many of the allergens in the environment can go through the skin. And so you really don't know on those horses, and to my knowledge, there hasn't been research on that. If you put Dex on a normal horse's skin, or you put one on the skin of a horse with severe IBH, how much of it is going systemically. But that's something that we haven't brought up, which I think is something to use in your arsenal. And I wanted to say, you know, I mentioned that in severe allergies, you may need to stop the itch scratch cycle with a proscribed. That means a predetermined amount of time you're going to give steroids. The caveat being that insulin dysregulated PPID horses are not a good candidate for that. But you should think of the use of steroids like dropping fire retardant out of the sky on really bad forest fires. You know, it's the emergency, get a handle on it. And then everything else you do is all the groundwork that goes on in fires to stop the fire from spreading and to eventually put it out.
Dr. Yardley, Jay in England asks if there are any natural remedies that are proven to be effective in treating horses with allergies.
I think that one of them that we know of would be, from a natural standpoint, would be adding some of the omega-3 fatty acids back into the diet that we kind of had talked about earlier. There is some research out there that for the horses with asthma, it did change somewhat the immune profile in the lungs in their sample of fluids, so of the lung fluids. So they did change some of the immune function there. So I would imagine omega-3s would be something I would feel very safe, recommended. Like was mentioned earlier by Dr. White, a lot of the essential oils, especially the tea tree oil, I've seen go sideways really quickly. And you kind of notice it, people even putting lavender on their horses for showing to calm them down. They have this huge lesion on their nose now because they've had some essential oils on there. So I'm very nervous with clients just kind of putting on a lot of different natural remedies, because just because they're natural doesn't mean they're not toxic to the horse.
Yay, Dr. Yardley, you're singing my song.
Yeah, they just are. Yeah, it's bad. I've probably seen not as many cases as you, but I've definitely seen the tea tree oil everywhere. They dumped it, and I was like, "You put something on this horse that has caused their hair to fall off." So, yep.
I can't say which products that are commonly used that have tream in them, but you should read the labels.
Dr. White, Karen in our live audience purchased a horse from Holland 6 weeks ago that has been snorting and sneezing more and more the past few weeks. Under saddle, he also sneezes and throws his head around at times and seems to have a very itchy nose. The barn is open and not dusty, his hay is high quality and not dusty, and he can go out of his stall into a mowed pasture. Could he be having an allergic reaction to pollen or plants in this country? How can she help him be more comfortable?
He definitely could be having a reaction to pollens or anything else in the environment that is aerosolized. You can have that same kind of reaction when horses within the United States moving from one state to another. If he throws his head around, is he doing that intermittently? You know, is he a head shaker, or is he just acting like he's got something up his nose and he's trying to shake it out? That'd be one question to ask. And the open barn is nice because I know all of us may have been in barns, and they smell moldy and musty when you first walk in them. Those are respiratory horror shows, but open barns can also allow whatever is in the air blowing in wind to come into the barn. I like the fact that the pastures are mowed and grasses are not allowed to seed out, or any other plants allowed to seed out in the pasture. But this is a horse that probably needs to be observed by your veterinarian and get a better idea of whether he's reacting. If he's only doing this when he's ridden, is he reacting to being ridden? Is he reacting to things that he's breathing in, or does he have a trigeminal neuritis associated with head shaking?
Yeah, I would second. The description she gave me makes me very worried about head shaking. It could be allergies too, but I would have your veterinarian come out and take a good look at that. It makes me nervous, just what the description was.
Dr. Yardley, Natasha in Texas has a 5-month-old filly that has been diagnosed with allergies. What treatment options could be safe for a foal?
Yeah, so I appreciate this question. It's a very hard question. And I think one of the things to think about with a foal at 5 months of age is we don't typically recognize quote unquote allergies with the horse. A lot of horses don't start forming IgE antibodies to the environment or in their bodies themselves, their immune system, until they're maybe 9 to 12 months of age. That's why we don't really start vaccinating our foals until 5 to 6 months, because their immune system's still really naive. They still have some maternal antibodies. So I guess one of the things I would recommend would be maybe some further diagnosis as to like why we think it's allergies. Like, could it be a skin infection? Could it be with a bacteria or a fungus, especially for the more human part of the Gulf? Funguses would be one of the things. Could it be an external parasite that is causing some issues? So I would kind of hesitate to say the foal has allergies per se at this young age, and that maybe there's another underlying condition that's causing maybe the itchiness or the hair loss. So I think working with your family veterinarian would be a really good place to start to make sure we're not missing anything. If it had respiratory, so if it had like nasal discharge, a 5-month-old foal, rhodococcus, pneumonia would be something to think about. Internal parasites, ascarids, which is a lungworm in the horse. Those types of things are kind of running through my brain, thinking about a foal more than allergies for a respiratory sign. So I'm just kind of thinking of other things maybe before we say that it's just allergies. It's just kind of my take on that.
Dr. White, Carrie in Mississippi wants to know how effective acupuncture and acupressure are for horses with asthma.
That is a good question, the fact that it's very topical. If you read a lot of equine related chat on the internet, there's an awful lot about acupuncture for a whole variety of medical problems in horses. In humans, acupuncture has been shown to help relieve pain and inflammation associated with chronic inflammatory pulmonary diseases. Whether or not it's helpful in horses, despite the wide number of anecdotal testimonials, is questionable. I did try and read some research papers on this, and I could find one which was actually a controlled experiment, and they found no difference in acupuncture and simply handling the horse. They had the controlled environment in known asthmatic horses to induce asthma, and then in the controls they got handled and petted and this, that, and done to them, and then the other group was given acupuncture, and there was no difference. So I think that the jury might still be out, but I think it's important to realize that if you believe you have a horse that responds well to acupuncture to treat equine asthma, that it's no different than pharmaceuticals in that it's changing the way the body responds to the allergen, but it has not diminished the disease, if you will, the disease being the abnormal immune response when experiencing the allergen. So regardless of what you're using, management is very important. And I think that I would be overall skeptical that you're going to see marked improvement with acupuncture, although you may be able to relieve anxiety in a horse that has a reduced arterial oxygen tension, and you may be able to reduce some of the effects of, the horse's very labored breathing. But I think I would reach medication before I reached for acupuncture, after I tried to do as good of management of the environment, the food, etc., that I could. And I'd be most interested if Dr. Yardley has any experience with this.
I don't have any experience with it. I just have only come across a review paper by Dr. Eaton in Arizona, who talks about using acupuncture in allergies, very similar to what you described, of decreasing inflammation potentially. I always think of acupuncture in my practice. I don't practice acupuncture, but I recommend a veterinary acupuncturist for pain. And I think what you said hits the nail on the head for all these diseases, is that we're treating the clinical signs a lot of the time, and we're not treating the actual diseases. So if you want to use acupuncture as an adjunct therapy to help the horse, I don't see that being a problem. But I don't necessarily know, like I always tell my clients, like, if your horse has liver disease, acupuncture is not going to cure its liver disease, but it might make it feel a little better if it has a sore muscle. So like it helps with pain a lot, helps the pain pathway. So I think some of the other things we try to use it for, I'm not necessarily convinced the literature shows any evidence of that.
Dr. Yardley, Robert in Massachusetts asks if there's any connection between allergies and GI problems in horses.
That's a great question, Robert. Originally from Massachusetts myself. Hopefully he's a Patriots fan. Food allergies. We don't necessarily know a lot about food allergies in the horse. There is some foods, potentially higher protein foods, maybe that could be linked to allergies. I think more of thinking about like your hay source. Is it dusty? Is it moldy? More of those environmental things. Are you feeding your horse in a hay net? So above the ground, and your horse is inhaling all the dust from the hay. Are you bedding your horse in the straw? So more of those environmental things, more than causing like a GI, like a food allergy per se. I don't think there's a lot of literature on food allergies in the horse. There are some very specific papers about food allergies in the horse, but it is a very specific subset of horses that had inflammatory bowel disease, that had biopsies to prove they had inflammatory bowel disease, and there was a food allergy component. They had to do a food elimination trial to figure it out. So that'd be, if you're worried about that, it's very hard to do, but the gold standard is a food elimination trial. So you change the proteins and you only feed a certain source of allergen, basically, of food or hay, would be the way they do it. At least they do it in dogs and humans. But so I think overall, I'm going to hedge on my answer here and say there's not a lot of evidence to show that.
I agree. I've documented a few real cases of food allergies, but that's very rare. If you think you have a food allergy, my first advice is eliminate all supplements with soy and alfalfa in them, because there's some of the bigger problems with those ingredients.
Yeah, there are companies out there trying to sell people on corn-free and this free food, but I don't necessarily know there's any evidence. I feel like it's more marketing.
Dr. White, Francie in Hawaii wants to know if NSAIDs can be used to manage a horse's allergies. And in the chat, she said that she does not want to use steroids because her horse has a history of laminitis and antihistamines don't seem to improve his condition. She's also curious about supplements and complementary approaches for helping her horse.
Non-steroidal anti-inflammatory drugs manage pain and inflammation related with pain. And so in that sense, they might be somewhat helpful, but they are not generally going to be more effective than the traditional medications that are used. And she's already said steroids are off the table. I've had a number of clients that feel the same way. And I would, one, be interested in how old the horse is. Just because, and this is my opinion, not anything you'll find in a peer-reviewed paper, but I think younger horses respond to allergy shots better than older horses. But this would be a horse that I would recommend to have the allergy testing, IDT, hopefully, if not available in Hawaii, to do the serum tests and then go to the allergen-specific immune therapy. I mean, that's what I recommend to people who come to me with that same situation. Antihistamines are not helping, steroids are off the table. What do I do? One of the things about allergy testing is you might find that the animal is on a pasture. I know there's specific grasses that grow in Hawaii, and the animal has an allergy to those pasture grasses. And so one of the things to help the horse is to not just use the shots, but take away that source of food. So they aren't associated with the pollens that may, or other components of the grass that may be contributing to the allergy.
Do you think she could use Apoquel if affordable in the meantime? Maybe help with some of the clinical signs?
Okay.
I know it's very expensive.
I have not brought up Apoquel because it has yet been released with an equine label, but it's coming.
That's true. Yes.
So it's off-label use. The other thing is there is a subset of horses, and there is a gentleman, a dermatologist at UGA that is an exquisite researcher in dermatology. There are horses that respond beautifully to Apoquel. It's a game changer. And if they're going to be responsive to Apoquel, they will do so in the first 2 weeks, maximum 3. If they don't respond in that period of time, it is not going to be a useful drug for those horses. And there is a dose, which I'm not going to say on the internet because I'm not prescribing a medication for a horse. There is an accepted dose that is used, and more is not better, because if it's a non-responder, more of the drug is still not going to make a difference. It is very expensive, but it is made night and day difference in some horses.
And there's at least some pharmacokinetic studies for veterinarians prescribing off-label, which would make them feel a little safer.
Yeah.
Dr. Yard, sorry, go ahead.
Oh, sorry.
All right, Dr. Yardley, this will be our last question of the night, and it's from Karen in Kentucky, who wants to know if there are any dietary changes or supplements that she can add to her horse's diet to support a horse with skin allergies.
Yeah, so I think we kind of talked about some of the supplements with the higher proteins, alfalfa and soybean, might be linked to maybe some more allergies, maybe potentially adding omega-3s would be helpful or could potentially be helpful to the diet. But I think overall is you need to kind of figure out what your horse could be allergic to, like what is causing these skin allergies, and then eliminating those from the environment. So doing the diagnostics, unfortunately, is going to probably get you to an answer quicker than trying to figure out what to feed the horse that's different. So kind of like we've been talking about all evening, doing allergy testing is going to probably be the gold standard place to start, and then we can start eliminating some of these things from the environment. Hopefully the horse is not allergic to Kentucky bluegrass.
Very true. That's all the time we have for tonight. We've covered a lot, and I hope our listeners have learned as much as I have. Thank you, Drs. Yardley and White, for joining me.
Thank you. It's a pleasure.
And thank you to Kinetic Vet for sponsoring this event. And finally, thank you to our audience for listening and sending in these questions. If you're listening to us after the live event as a podcast episode, please rate, review, subscribe, and recommend Ask the Horse Live to a friend. Until next time, from everyone at the Horse, have a great night.